So we looked at the eye muscles. Now let's look at the face muscles, in particular chewing muscle or facial expression muscles and chewing muscles. Maybe I'll put them all together because there's not too many of them. So facial expression muscles are muscles that help you basically move your face and communicate non-verbally through all those different expressions that you make. All of these muscles are innervated by cranial nerve number 7. And I'm just going to make that a green color. I don't know why I think about cranial nerve number 7 as being green, but for some reason I do. And I always think about cranial nerve number 5 as red for chewing, but I don't want to make that red because all my muscles are red. So we're going to look at cranial nerve number 5-3. That's mandibular nerve as well. And let me write facial here. Okay, so you have things like this muscle in the front, which is frontalis, right? And then we have our muscle in the back, which is occipitalis. So frontalis and occipitalis help us basically move the scalp. Frontalis helps us pull it forward, and occipitalis is really helping us retract it, so kind of moving our eyebrows more upward. Then you have some nice muscles that are circular. So we see this nice circular muscle that goes around the eye, and we have a nice circular muscle that goes around the mouth here. These are both called orbicularis. So the one that goes around the eye is called orbicularis oculi, and basically it actually is going to help you with squinting. So like squinting your eyes shut or winking, that sort of a thing. The muscle that goes above that, this muscle that goes above it, is the levator palpebrae superioris. So this is the muscle innervated by cranial nerve number 3 and helps us with blinking. So actually moving your eyelid up and down. Then we see that the other orbicularis muscle is called orbicularis oris. Orbicularis oris helps us close our mouth, usually helping us pucker our lips. So like puckering up for a kiss, something like that, blowing a kiss. And then you have a couple of muscles in the nose area. We're going to ignore those. We see one muscle right here and one muscle right there is a strip, and then there's a third strip-like muscle. If you look on the lateral side of the face, there's 1, there's 2, and there's 3 right there. So let's see, this is number 5, got number 6, we got number 7, and then deep underneath that is number 8. Then we have a nice little tiny one here, which is number 9 in the front. So number 5 and number 6 are the zygomaticus muscles. 5 is zygomaticus minor, and 6 is zygomaticus major. Both of those help you elevate your lip when you're smiling. Number 7 is risorius. It helps you pull back the corner of your lips, like kind of when you smile, but you're not smiling upwards. And then deep to risorius is the buccinator muscle. Buccinator muscle helps you compress your cheeks during the sucking motion. So like if you're using a straw to suck your boba tea, that's going to be the buccinator muscle. Also the muscle most pronounced in infants because infants have to use a sucking technique in order to feed. And then number 9, this little strip-like muscle in the front here is called mentalis. Mentalis is the muscle that's helping you protrude your lower lip when you pout a little bit. And then there's one that's not on here actually that would cover all this superficial area of the neck, and that would be platysma. Platysma is going to help you lower your jaw a little bit, but also helps you with tensing the neck. So like you see that tense muscle that's causing my skin to wrinkle, that's what the platysma muscle is doing. So since we're here, I'll show you some of those chewing muscles as well. We're going to see that when you look on the lateral side, we have this nice big muscle here, which I'll label as number 11. This is the temporalis muscle. The temporalis muscle comes in and inserts on the coronoid process of the mandible and helps you elevate the jaw during chewing. And then there's another muscle right here. So this is actually a salivary gland. It's the parotid salivary gland, which we'll learn in 2240. The muscle that's right underneath that is called the masseter. And the masseter basically goes to the angle of the jaw and comes up to the zygomatic arch and helps us again elevate during chewing. So I have these same pictures here again for muscles of mastication, where we're going to see temporalis. And we're going to see masseter here, just like that. There are a couple other muscles that are innervated by cranial nerve number 5-3, but they're not exactly like chewing muscles. They're not exactly facial expression muscle either. They're muscles that are innervated by this nerve because they're made in the same way that these muscles, the chewing muscles, are. So on this model, we see temporalis here, again on the temporal bone, and masseter is much more pronounced right there. There are two deeper muscles. You have to remove the jaw to see them, and that's the medial and the lateral pterygoids. They are innervated by cranial nerve number 5-3, the mandibular nerve. But they're not really visible unless you cut off part of the mandible. So the other muscles that are innervated by cranial nerve 5-3 is going to be the anterior part of digastric, which is right underneath. So you can kind of see maybe a little bit right there. This is digastric, the anterior belly. Which does help pull down the mandible slightly, but also helps you elevate the hyoid. And then there's a muscle deep to that, and that's called mylohyoid. And mylohyoid, again, kind of helps pull down the mandible, but mostly helps us elevate the mandible. And both of those are also innervated by the mandibular nerve. Even though they're not traditional chewing muscles, they are still innervated by the mandibular nerve.